And if you have questions during the webinar, you can put them in the chat and we will address them there. And again, we're just waiting for a few more people to connect and then we'll get started. So just bear with us a moment. Thanks for being here today. Okay, it looks like most people are connected. So in the interest of time, we're going to get underway. Thank you all so much for joining us for today's community conversation. The topic today is understanding trauma and resilience in the lives of contemporary Native Americans. And we are joined today by Dr. Hilary Weaver, who I will introduce shortly. Just a couple of housekeeping notes as we're getting started. Please remember that this webinar is being recorded and we will be making it available on the NASW New Jersey YouTube page after this event. And we'll also send a copy of the link to everybody who registered. So if you aren't able to be here in person, you'll be able to watch the recorded version. Also, just remember, as there are a number of people on this call and we are being recorded, please keep yourself on mute so we can limit any background noise or interruptions. We'll proceed through the presentation and have time for Q&A at the end. If you have questions, you can put them in the chat here on Zoom. If it's appropriate to interrupt at the time to address it, we will. Otherwise, we'll save it to the end. And hopefully, we'll be able to have some of you also unmute and ask your question directly to Hilary as well. So again, thank you for being here today. This is Understanding Trauma and Resilience in the Lives of Contemporary Native Americans. My name is Jeff Feldman. I'm Director of Advocacy and Communications here at NASW New Jersey. And I'm very happy to introduce today's speaker, Dr. Hilary Weaver. She is Professor Emeritus of Social Work at the University at Buffalo School of Social Work. She is also the board chair of the Council on Social Work Education. She is the Global Indigenous Commissioner of the International Federation of Social Workers and the president of the Indigenous Tribal and Social Work Educators Association. Hilary was also just named an NASW pioneer by the NASW Foundation. And so, Hilary, thank you so much for joining us today. We are really, really thrilled to have you here.
Thank you. I'm excited to be here too. If we could bring the PowerPoint up, I think we're ready to.
Absolutely. Yeah, let me get that started for you. And when you need me to advance, Hilary, just give me the nod.
All right. So my topic for today is understanding trauma and resilience of the lives of contemporary Native Americans, particularly focusing on how social workers can repair harms and promote social justice. If anybody's interested in reaching out to me at a later time, that's my email on this first slide. Next slide, please. So I'm speaking to you from Onondaga Territory in snowy but sunny Western New York. I am Lakota, and I want to tell you a little bit about the lens that I bring to this work. So I am Lakota, which is one of the larger Indigenous groups in the United States, but I've spent the majority of my adult life in Haudenosaunee territory. One of the few words from my Lakota language that I remember my mom using was Iyeshka. That's a Lakota term for somebody who is of mixed heritage. And she talked about me being a Yeshka as being born to be the bridge between cultures, the interpreter, the translator. And that's really how I have built my career as a social worker, making sure that other social workers understand Indigenous cultures. So I've got a picture from one of my books there in the left-hand corner. And it is very much grounded in my Indigenous culture. The other picture that I share with you, I'm certainly a community member as well. I live in the urban Native community here in Buffalo, New York. I love to dance at powwows. It's part of how I maintain my perspective, my culture. And a couple years ago, I was trying to figure out, now, when is this Fort Erie powwow? I love to dance at that one. When are they going to have their powwow? Finally found an advertisement for the powwow, and lo and behold, they had used my photograph from a previous year for their advertisement. So that's my picture on a powwow poster. Briefly, what I'm going to be talking with you about today is that trauma and resilience. I do believe we have to understand history to know where we are today. So it's both historical and contemporary. And I'm going to talk about the social work intersections, and then hopefully leave you with kind of a call to action. How do we move forward together in respectful and powerful ways? I'm going to try and talk for about 40 minutes and then leave some time for discussion and questions. Next slide, please. So like I said, you got to start with that history, because history lays the foundation for where we are today. The first thing you must understand is that there has always been tremendous diversity among the people now known as Native Americans. Just like in Europe, there are differences between people who are Polish and Italian and Swedish, and you wouldn't expect them to be all the same. That's how we should think of Native Americans. We were separate nations, separate peoples, and some commonalities, but some differences as well. And you notice that I'm using that term nations. Social workers need to understand the concept of sovereignty, and I don't think we have a full grasp of that. It's something inherent, it's not bestowed. So when Europeans first came here from their nations, they encountered the nations that were here, and agreements were made on a nation-to-nation basis or government-to-government basis because of this inherent sovereignty. That's where the treaties come from. Agreements made between powers that recognize each other. The one picture I have here that's in color, that is what we know is the two-row wampum belt, and that's how many of these treaties were commemorated. So it wasn't necessarily a written document in the way that Europeans would recognize it. But you see two parallel lines commemorating two distinct ways of life. There's no hierarchy there. It's like the Europeans came in their boat and they will sail down the river of life. The Indigenous people have their canoe. We're sailing down the river of life. Same river, different boats. So it commemorates our understanding of equality, and treaties still exist today. In fact, the US Constitution acknowledges that treaties are the supreme law of the land. So understand this history of early contact, understand treaties, understand the impact of disease. A lot of the population decimation for Native Americans happened not through warfare, but because of the impact of disease. I became a social worker in the 1980s when we were first trying to figure out what is HIV, what is AIDS. And I heard people in my Indigenous communities hearkening back to, boy, we have dealt with decimation by disease before. In the last couple of years, when we've been grappling with the COVID pandemic, again, people are remembering the history. The history is not something past and forgotten. It shapes how we think about things today. So know that the history of decimation by disease that happened sometimes deliberately, as in this cartoon where the character that looks like Pocahontas is saying, "Smallpox infested blankets? Thank you, John Smith." I've spent the last 28 years working at University at Buffalo, which is in a suburb of Buffalo known as Amherst. Amherst was a British lord who documented deliberately sharing smallpox-infected blankets and watching to see if it would have the desired effect. So this stuff has a lot of contemporary implications. Native people were removed from their lands. So a lot of the places where we live now are not where we originally lived. People were taken along the Trail of Tears, the longest walk for the Navajo. So removal was a way of clearing the land of Native people so the lands could be used and exploited by non-Native settler societies. Another policy that social workers need to know about is the boarding schools or residential schools, which were a strategic form of assimilation. When we weren't all wiped out by disease, we were removed but still existed in our lands, cultures were not completely decimated. So the slogan of the boarding schools was kill the Indian, save the man. So cultural genocide is a form of forced assimilation and integration. Allotment was a policy where the remaining reservation lands for many Native nations were further cut up. We owned our lands in common, even on reservations, but it was a federal policy that was undermining how we defined our family and how we defined our gender roles. So they tried to impose nuclear family structures with male heads, and land was divided up. You know, here's 160 acres for you, here's 90 acres for you. So it was divided up. That was called allotment, and it resulted in kind of a checkerboard formation of a lot of lands. By the 1950s, the federal government had a policy of termination where Congress would pass legislation to say that a Native nation no longer existed anymore. So with the stroke of a pen, Congress could eliminate the Native people that had not been eliminated in other ways. After that policy, there was a policy of self-determination, but I do want to make clear that regardless of what these federal policies were, we have always had resistance. There has always been continuity amidst turmoil. So while it was helpful to have policies of self-determination, we have always done that anyway. Next slide, please. I realize I have a lot on these slides, a lot of history to cover. So how does social work fit into this? Well, we have always had Indigenous helpers, activists, and social workers. This is something that is very compatible with a lot of Indigenous cultures. In our cultures, we focus on relationships, on connections, on community well-being. So it's not surprising that a number of Indigenous people are drawn to the social work profession. I've got pictures of a couple of very notable social workers here, starting with Ada Deer. She was the first Indigenous woman to get a master's and MSW from Columbia University School of Social Work in 1961. Her nation, by the way, the Menominee, was one that had been terminated by the federal government. There had been legislation passed to eliminate the existence of her people. What had been a reservation became a county. What had been a self-sufficient community with their own hospital, jobs were gone, the hospital closed. Ada will talk about how she used her skills as a social worker, as a facilitator, to bring people together, to advocate. And through that work, the termination was overturned and her tribe was reinstated. I also have a picture of Wilma Mankiller, who some of you know is now on the quarter, one of the quarters for the United States. She's a social worker as well. She had a BSW and became first woman principal chief of the Cherokee Nation, using a lot of her social work skills in a very macro context for community development. And there are a lot of people whose names are not necessarily familiar to you, but have always stood up as advocates. So I have the logo there for WARN, Women of All Red Nations. A lot of what we know of the atrocities that social workers have been involved with is because people like the Women of All Red Nations have stood up and publicized this. So social workers have often been agents of social control. You know, we do good stuff like Ada and Wilma did, but we also uphold the norms of a colonial racist society. And some of the ways that we have done that are through healthcare and particularly through the child welfare system. So briefly mentioning health aspects first, between 1970 and 1976, certainly within my lifetime, between 25 and 42% of Native American women, all Native American women of childbearing age, were sterilized. I think that's an astonishing statistic. And it's because there was access to Native American women through the healthcare services that were provided by the federal government. Social workers were complicit in these processes. You know, sometimes we pressured Native women to be sterilized so that they could keep welfare benefits or keep their children. Like, oh, if you don't consent to sterilization, we're taking your kids away. So a lot of women were pressured or were asked to sign forms when they had just given birth, when they were coming out of anesthesia. It's certainly not informed consent. Social work profession has been very active in large-scale removal of Native children from their families. That's probably one of the biggest ways that we have harmed Native American communities. And we've given these large-scale removal programs credibility and legitimacy. But these programs are often based in racial bigotry and colonialism. I'll give you an example on the next slide. So if we could advance, please. So a little bit of a more in-depth look at the Child Welfare League of America. They did a lot of the preliminary work, really prototypes for what would happen in child welfare. They did basically pilot studies. So between 1958 and 67, they had a federal contract. So they were contracted by the government to conduct this experiment. Let's remove some Native children from their families, not just from individual families, but from their tribes, from their cultures. Place them with non-Native families and let's study these transracial adoptions. Let's see what happens when we do this. So it started with the 395. Then there was a successor project of 650 Native children. Meanwhile, social work researcher David Fanschel is documenting this project, and he publishes a 1972 book, Far from the Reservation, about transracial adoption. I think the bigger point is that this was just the prototype. This was just the tip of the iceberg. States and their child welfare organizations were encouraged to expand these so-called rescuing practices. As you can see, this is heavily steeped in values about, you know, how children should be raised, who should raise them. I've got some pictures of that newspaper article. Hundreds want Indian adoption. So lots of non-Native people were clamoring to rescue these poor little Native children. Below that, there's part of a press release that goes with the old song. Probably a lot of our audience is younger than I am, but I remember a song that starts, 1 little, 2 little, 3 little Indians. And then the press release goes on to say, and 206 more are brightening the homes and lives of 172 American families, note American families, mostly non-Indians, who have taken the Indian waifs as their own. I mean, think about that language. Think about the values behind that as we talk about Indian waifs and rescuing. Next slide, please. So let's talk about where we are today. We continue to be very, very diverse. That has not gone away with the march of time. There are still at least 573 Native nations. And I say at least because the number changes all the time. These are federally recognized tribes that the US federal government has basically given their stamp of approval to and said, we recognize that you exist. There are many other tribal groups or Native nations that don't have that federal recognition, many that apply for it. And because you can apply, the number changes regularly. So no, there are a lot of us. And we're still different. We have different social structures. We have different languages. We have different spiritual traditions. We have different forms of governance. We have different lines of descent. Like some nations are matrilineal and matriarchal. I'm speaking to you from the Haudenosaunee Confederacy, which is still matrilineal. You are who your mom is. So your citizenship as a Native person comes through your mother, regardless of who the father is. Some are patrilineal, patrilocal. We live in cities and on reservations. For decades, the majority of Native people have lived in cities. And so I've got that picture of Mohawk ironworkers. I think that's New York City. I'm not sure. It might be Chicago. I mean, we built a lot of the cities. And so there have been large urban Indigenous populations for decades. Connection to culture varies. Even within the same family, you may have a brother and sister that experience their identities differently. As social workers, you got to begin with a strong assessment of who your Native client is. You can't make an assumption based on somebody living in a city or what their name is or what their phenotype is. And one thing that you should ask about is citizenship and enrollment. Because politically distinct, we have a distinct legal status. It's not a racial status, it is a political status. Goes back to that sovereignty that I talked about in the beginning of the history section. Enrollment, oh, we're moving a little fast here. Can we go back? Thank you. So I think I need to tell you what enrollment is because it's not a common term that people necessarily recognize. It means being listed on the tribal rolls, and it is the equivalent of citizenship. And it means if you're enrolled or your client is enrolled, they may have access to different social programs, different benefits than somebody who is not enrolled. So it varies. A few commonalities that I will mention because there are common values across tribes and across Native nations. For most of us, women and children are sacred and have a particular role within our societies. There is gender fluidity. Even when there's different roles for men and women, it's non-hierarchical. We have a lot of interdependence. We are connected, both to people in our communities and to non-human relatives, to the natural world. There is a sense that we are all related. And with relationship comes respect, comes responsibility. And I'll briefly mention the concept of the 7 generations. It's interpreted a little bit differently depending on the Native group that we're talking about. But it basically means that an individual is nested within those who came before and those who come after. So it could be like the 7 generations before me, the 7 generations after me, or 3 before, 3 after, and I'm nested in the middle. This is often used in a lot of prevention messages. Think of the future generations, when you're making decisions about whether you will drink when you're pregnant or whatever actions, however you carry yourself, plan for the future, because I am only here because somebody planned for me and I have responsibility to carry that on. Next slide, please. So contemporary realities, this is a balance of trauma and resilience. It's not one thing. We have persisted within multicultural contexts. A lot of the urban areas that we live within are not only multi-tribal, but multi-ethnic. If you look at the literature on Native Americans, you will see a lot of disparities, whether it's economic disparities, educational disparities, social disparities, health disparities. But no, that's not the whole story. We have resilience as well. I talked a little bit about the extensive child removals. Well, know that that was counterbalanced with the Indian Child Welfare Act, that people advocated and said, hey, if we lose our kids, we lose our future. We cannot continue as Native people or nations without our children. People stood up, people advocated for that. That being said, the Indian Child Welfare Act, also known as ICWA, has never been fully funded or implemented, so there's problems with that. And some of you know that the Supreme Court of the United States heard a case on November 9th, so about a week and a half ago, that threatens to overturn the Indian Child Welfare Act. We don't know how that's going to go. But a lot of people are advocating, are standing up, are fighting for it. There is a lot of violence and racism toward Native Americans. This report that I cite here, the Attorney General's Advisory Committee on American Indian and Alaska Native Children Exposed to Violence, has some really startling statistics. We have, our Native children have the same rate of exposure to trauma as combat veterans from Afghanistan and Iraq. That's astounding to me. But we do have a lot of exposure to violence. And of course, some of you may have heard of the missing and murdered Indigenous women. And if you haven't heard of it, you should have heard of it, because thousands and thousands of Native women, girls, and gender diverse people have gone missing and been murdered. Again, we're not being quiet about this. There's tremendous activism. There is leadership. So where there is trauma, it is always balanced with resilience. And I couldn't resist this picture in the corner. I don't know how many of you recognize that. It's from Alcatraz. It's an Indians Welcome, U.S. Penitentiary. Yeah, we do have very, very high rates of incarceration. But the picture is all actually taken when Native activists took over an abandoned federal facility. And the law does say that when there's abandoned federal land, Indigenous people do have a claim to that land. So activists took it over. So kind of some multiple meanings there. Indians welcome at the U.S. Penitentiary. Next slide, please. So where do social workers fit in? There are a lot of Indigenous social workers who are professionals really walking in both worlds, who are that bridge like I try to be. So I've got that logo for the Indigenous and Tribal Social Work Educators Association. Right now, and in fact, for decades in the United States, we have not had a national functioning group of Native social workers, but we have a national functioning group of social work educators. So it's inclusive of students, social workers, and educators, even though educators is in the title. When we talk about non-Native social workers doing social work with Native people and nations, I think that Native people are still largely invisible, and social workers still don't have a full understanding of the Indian Child Welfare Act, don't fully understand sovereignty. So we have a ways to go to to live up to our value systems and really be the best that we can as social workers serving Native people and nations. Still, disproportionate child removal. A lot of problems in the child welfare system. I did a study a number of years ago trying to really get at what does cultural competence mean when you're working with Native clients. And the major findings were, well, yeah, social workers need good general skills, but we also need containment skills, meaning sometimes we need to deliberately allow that silence. There are different communication norms that many Indigenous people have. And often, even though you wouldn't know it by how fast I'm talking now, often we talk much more slowly. Social workers need to just kind of restrain themselves a little bit, let people talk, really focus more on listening. We as social workers need to focus on our own self-awareness and helper wellness, because unfortunately there are times when social workers, like other people, get a little too excited when they meet a Native American person and they're like, oh, tell me about your culture, and a little voyeuristic. So we need to draw our wellness from other sources, not our clients. We need to express humility and a willingness to learn. All clients really are our best teachers. They need to tell us about their life circumstances. We need to proceed with respect, being open-minded and non-judgmental, because some of the things that you hear about your Native clients may be outside your own life experience. That's okay. Different is not lesser than. Different can just be different. And we must proceed with the social justice lens. Next slide, please. So go ahead. As we move toward action, I'll tell you that some action, not enough, but some action has already happened. I talked about those child welfare disparities and those prototypes, those pilot projects. A lot of what we know is because the Child Welfare League of America has stepped up. They have apologized, not only generally, but specifically in a keynote address to the National Indian Child Welfare Conference. Their president noted, while the past cannot be undone, facing it squarely and publicly is the best way to move forward to build a future. I think that public acknowledgement took a lot of courage. And that was in 2001. So if you get a chance to look at my slides later, there's a link to that public apology. Next slide, please. And I do think people in Canada have been more forward-thinking than those of us in the United States. The Canadian Association of Social Workers, they issued their statement of apology and commitment to reconciliation in 2019. Noting our profession's complicity. I like that word, complicity and colonization. We were part of the instrument for how nation states did this to Native people. And they acknowledge it is both past and present. And there's a link to their statement. Next slide, please. And the Canadian Association of Social Work Education, they had a similar statement. So both their practice body and their educational body. And so they talked about how social work education, research, and practice have been and continue to be, again, current as well as past, complicit in our colonial reality. Such complicity contradicts the espoused values and ethics of social work, potentially negates the positive impact of social work interventions, and results in harmful policies and practices. Major point here, we should do better. We know better. We come from a really good profession, and we've been a part of doing some not so good things. So there's a link to their statement. Next slide, please. So we finally got around to doing something in the United States. 2021, largely using these Canadian statements as a model, Members of the Indigenous and Tribal Social Work Educators Association that I mentioned got together, drafted something. It's a really long statement because we wanted impeccable documentation of what social workers have done. We presented it to the CSWE Board of Directors that unanimously passed this statement in 2021. And there's a link to the statement. Next slide, please. I'm going to go a little bit more in depth on this statement, and then I'm going to wrap up and allow some time for questions. So why did we do this? We wanted to hold our profession accountable. It's more than an apology. It's more than an acknowledgement. We wanted to push our own profession and transform our own profession so we would stop the continuing harms. We know that acknowledging injustice provides validation. And, you know, a lot of people still feel really disenfranchised, even though you have Native people walking in both worlds, being social workers and being Native, you know, it can be a struggle. And I know colleagues that were in the audience back in 2001 when the Child Welfare League of America made their apology. And they still tear up talking about how that felt to hear people acknowledge what had been done to our people. It's powerful, it's transformative. We wanted that with the American statement, with the CSWE statement. We want to promote healing. We were also very clear that in no way Indigenous people have been passive victims. We have always had strength and agency, but we still need to hear that wrong was done to us. And this acknowledgement of wrongdoing, that will help build trust between Indigenous people and social workers. And it will minimize the chances that we're going to keep making the same mistakes. Next slide, please. So this is specifically from the CSWE statement. There are calls to action. So a lot of it documents what happened, but now it's what do we do about it? We commit to active engagement across policy and practice levels. So it's not just clinical stuff. It's not just policy. It's everything that we as social workers do. So we have to repair the past harm. We have to stop current harm and prevent future harm. So it's on all these different levels. It's individuals, it's families, it's communities. And a lot of what we do as social workers, we're really good at advocacy. But yet the treaty and public policy obligations to Indigenous and tribal peoples have never been fulfilled. That's something where we as social workers can step up and say, hey, there are legally binding agreements here for healthcare, for education services, for many things that have never been fulfilled. And those of us in research roles, we need to be inclusive. When we're doing research, Indigenous and tribal people need to be included at every level, and research should be driven by Indigenous people, not just outsiders coming in deciding what needs to be done. Next slide, please. We have to decolonize social work education because that's where we all learn to be social workers. We need to be teaching the good stuff, not the bad stuff. So we need to recognize that Western paradigms continue to be privileged. Western paradigms aren't the only game in town. Let's be inclusive about what we're teaching, about how we're teaching it. Otherwise, we're going to keep perpetuating these harms. We need to support self-determination in communities. We as social workers know this. We know that we don't just swoop in and do things to people or on behalf of people. It must be grounded in self-determination. And part of this is recruiting and supporting Indigenous tribal people in our profession at every level. Next slide, please. Because the social work profession is us. We have responsibilities and we have opportunities. We can be so much more. We can actively shape our profession. We can set our priorities. We can reclaim the social justice foundation of our profession and really make our values of justice a reality. We've done a lot of problematic things as social workers. We don't have to continue that. We can embrace our power to move our profession forward in respectful and powerful ways. Next slide, please. I feel I've been talking really quickly. I'm going to wrap up and open it up for discussion and questions. I'm really thankful for this opportunity to be here with you. My following slides are all like a reference list that I hope will be helpful for people. But let's open it up for discussion and questions.
Dr. Weaver, thank you so much for that presentation. That was a lot of information, but so informative. And I know for me, a lot of it was stuff I hadn't heard before. And coming from a social work background and having a social work education, it's kind of embarrassing to not be aware of some of this stuff. So we still have about 15 minutes left. I'd love to be able to share some of your questions with Dr. Weaver. You can put them in the chat, or if you'd like to ask your question directly, feel free to raise your Zoom hand and we can ask you to unmute. One question I have while we're waiting for a little bit of questioning to come in, I'm wondering if you could say a little bit more about, I think it was the Indian Child Welfare Act that you said was recently in the Supreme Court. Would you like to share a little bit more about that situation?
Yes. So I'll try and give a simplified version of a very, very complex issue. The Indian Child Welfare Act, which was passed in 1978, has always experienced legal challenges. There have always been people saying, you know, we can't have this law based on race. Well, it's not based on race, it's based on political status as Indigenous people, as members of sovereign nations. And one of the primary things in the Indian Child Welfare Act has to do with jurisdiction. So whenever an Indian child, and that's what the law says, the phrase is Indian child is at risk of removal from their family. So this is either a foster care placement or an adoptive placement. There is a set of preferences that comes into play where you try to keep them within the cultural context. And a lot of child welfare talks about, well, what is in the best interest of the child? Indian Child Welfare Act says cultural continuity is in the best interest of the child. So there's a set of placement preferences. If the child cannot stay with the parents, you place them with a member of the extended family, you place them with somebody else in the tribe, you place them with another native family, or you place them with another adoptive family. So that's in order of preference for cultural continuity. It also says that as citizens of tribal nations, when a child is being removed, that tribal nation can take jurisdiction. So it doesn't necessarily go through a state child welfare system. If the tribe wants jurisdiction over their own citizen, they can exert that jurisdiction. The current legal challenge is a consolidation of multiple cases, often brought by non-native adoptive parents, saying that the non-native parents are getting discriminated against when they don't have the same access to native children that native people do. It's a very complicated issue. It's also complicated in that one of the legal claims is saying that the federal government should not be able to tell states what to do. which is very, very similar to the claim that was made that overturned Roe v. Wade, basically saying the federal government shouldn't be doing things, states should have their own right to do things. So those are some of the claims. I urge you to take a look at the reference list, because there's 2 articles in there on the current ICWA challenge, one being a really short one that was in the recent newsletter for the NASW Social Economic Justice and Peace newsletter, and one that was in the Journal of Public Child Welfare, because it's really complicated issues, but social workers need to have at least a basic understanding.
Thanks so much, Dr. Weaver. That is very helpful. We do have a couple of questions coming in now. I see that Tevin has a hand raised. Would you like to unmute?
Sure, thank you. So I have a question. So from the perspective of a social worker, why do you think, in your opinion, social work framework, why do you think there are entities that even care about Native children being placed with Native families? Why do you think that that's even a concern of some individuals?
Well, certainly among Native people, there is a concern that if our children are consistently being taken out of their cultural context and adopted by other people, there will be no future. There will be no cultural continuity. There will be no way for us to pass our values, our beliefs, our spiritual traditions, our language to the next generation if we don't have our children. So that's the concern from the Native family, that our future will be lost if we lose our children. I think that among non-Native people, there were some specific marketing efforts in the 1960s, well, really 50s, 60s, and 70s to rescue Native children, which has a lot of disparaging, value-laden connotations about our culture and Indigenous people in general. The idea that we need to be rescued from our own families is pretty problematic. But I do believe that some people bought into that and thought, let me be a rescuer. Let me save Native children. And Native children became commodified in that way. It almost became trendy to adopt Native children. And when you had things like the Indian Child Welfare Act come into play, you see increasing numbers of international adoptions, adopting children from Guatemala and other contexts that still were often Native children. So a lot of difficult stuff there.
Yeah, we have a couple of comments in the chat. Wynn notes that detachment from culture is one of the deepest wounds a person can experience. And also, Catherine says she recommends that people sign up for emails from the National Indian Child Welfare Association, NICWA, NICWA. They offer a conference and many training opportunities, as well as updates on the legal challenges to the Indian Child Welfare Act.
I fully agree. Those are great resources. And in fact, it was the keynote address at a NICWA conference where Child Welfare League of America offered that apology.
Thank you. We have a question from Razia, who's wondering, as a social worker, how can we work to build trust with Native American clients for a successful therapeutic relationship?
Well, trust is earned. And I think for a lot of non-Native social workers beginning to work with Native clients, you may experience some testing where people will not necessarily take your good intentions at face value. There was one job I applied for in Alaska years ago, and even in the job description, they said that a social worker wanting to work up there needs to be visible in the community. They were saying, you know, show up at community events so people see you as a human being, so they know that you're not just somebody swooping in. But yeah, showing integrity as a social worker, as a human being, showing up, being honest, being transparent, being truthful, that's how you build trust.
Thanks, Dr. Weaver. Other questions? We've got a lot of just acknowledgements in the chat, people thanking you for the presentation, thanking you for their time, for your time. Hang on, I've just got something. So let me read this comment. It's a bit long, from Cynthia. She says, my partner became involved out west during the occupation as a photojournalist. He worked with many Native activists like Regina Brave, Jaslyn Charger, Oscar Hayelk, and many more. Now she has become more involved in also participating in ceremony and learning medicine along with him and the Lakota family that they are connected to. There is a complicated issue with leadership during Sundance, I presume the film festival, and we are not sure when we will be able to participate with this family going forward. Are there local resources that might help us to lead to a place of practice so we may carry out our commitments?
Wow, there's a lot of stuff there.
Yeah.
And I would not presume that it is Sundance, the film festival. It may very well be Sundance, the ceremony that
Oh, sorry.
Cynthia has referred, although you never know. So I'm going to start with the end. Local. There are Native people everywhere. You need to know who is in your local community and what the needs of that local community are. And that will prepare you to stand as an ally and an advocate in service of that community. Sometimes people are drawn to different places, whether it's activism out west or whether it was DAPL in 2016, the Dakota Access Pipeline. There are a lot of activist causes now, but nothing beats helping people in your own backyard. It is never easy. There is often controversy about who should lead things and the role of allies. We as social workers know that a big part of what we should be doing is listening. Listen to what people are saying. And if you really listen, you will find good roles where you can be of service, where you can stand with people, where you can advocate for policies that impact people. If you listen, you will find the right role. I believe that allies have a lot of work that they can do. The ITSWIA group that I mentioned, it is Indigenous and Tribal Social Work Educators Association, and we came up with a statement that we brought to the Council on Social Work Education. A number of people seeing that statement come forward assumed that we did not have support from allies, assumed that we were an exclusionary group. But as Indigenous and tribal people, we have always had ways of making relatives. We have always had ways of connecting, and connection and relationship is key. Some of the major people who contributed to that statement were allies, and they were no less than anybody else in that cooperative group as we worked. So true allies, true social workers, there is a space for everybody as we move toward social change.
Thanks again for that great answer. A couple of other comments. Jeanette is thanking you and pointing out that many of us on the call are probably just now learning of our own Native and American Aboriginal heritage and delving into that. So thank you for the presentation. Isabel, a student from University of Dayton in Ohio, thanks to you for the presentation and says she can't wait to discuss it in her intercultural communications class. So thank you. And Catherine is recommending for people who are interested to look at the Native Land app. You can enter your zip code and it will tell you about the Native people who originally and or currently inhabit that area. That may be something that some of you may want to integrate into your Thanksgiving celebrations. If you're having Thanksgiving with family and friends, you may want to take time to do a land recognition. And you can use the Native Land app to do that. Comment from Judith, very grateful that we've had the presentation. She leaves the presentation further saddened and outraged by American colonialism and the concept of manifest destiny that underpins it. She'll be looking more closely for opportunities to call out cruel and disastrous beliefs. Somebody else acknowledging has connected to the Native Land app, and it's definitely changed the connection to history of land and people and the culture, and enriched hiking experiences for her. And Karen is visiting from the University of Belize and says this is incredibly important for her. Somebody else says we could have gone on for 3 hours probably, which we absolutely could have. And I will talk to our director of continuing education after this and see if maybe we can put together a larger presentation for sometime next year, either with Dr. Weaver or with another presenter. We are running close on time. Our director of continuing ed is on the call and she says a big yes. She's going to be looking into that. And Valerie says for other helpful info, she recommends reading the calls to action in the final report on Truth and Reconciliation Commission of Canada. Final report on Truth and Reconciliation Commission of Canada. As we're preparing, one more in the chat also, Liz is recommending the presentation that SURJ and NDN Collective shared on land acknowledgements yesterday, and she's placed a link to Facebook for that. And SJ says if you want to learn more about the ICWA case, the Indian Child Welfare Act, Hayland versus Brackeen, consider listening to This Land podcast by Rebecca Nagel, who is a Cherokee journalist. This Land podcast. And Oris also follows up with the comment from Belize saying she's currently in a human rights leadership program and is wondering what some international resources are to advance Indigenous rights. We're really short on time. Do you have any international resources in the slides? Do you remember, Dr. Weaver?
There are, other than Canada, and Canada is more advanced than the US. I do not have Indigenous or international Indigenous resources in the slides. I will tell you, however, that it is forthcoming. Please check the IFSW website, International Federation of Social Workers. We have only had an Indigenous commission for a little over a year, and that has Indigenous social work representatives from all 5 regions of the world. So there will be resources forthcoming.
Thank you so much, Dr. Weaver. And I just put up the very first slide from your presentation. Again, a couple people have asked for your contact information. So it should be on your screen now, hweaver@buffalo.edu. Also, we have recorded this presentation. It's going to be posted to YouTube later today, and I will be sending out a link to that YouTube document that will also include a link to Dr. Weaver's slides, and we will email that to you. If not today, then hopefully first thing tomorrow, and I will also put Dr. Weaver's email address in that email that goes out to all registrants. And I see you nodding, so I guess you follow up with her directly if you have other questions. It is 1 o'clock, so we will end, but thank you so much for being here with us today, Dr. Weaver. This was a wonderful presentation, and we're honored that you've taken the time to share it with us today.
You're welcome. I'm happy to be here.
Thank you all so much, everybody. Enjoy the rest of your week and have a wonderful holiday weekend.